Hello and welcome. In this course, we're going to be talking about the different senses of the brain. So we're going to talk about hearing, sight, and sensory integration. All of these senses are managed by the brain. And although many of the things we're going to talk about today work better as kind of an in-person intervention, I think it's really important for you to understand these different concepts and where these different senses come from in the brain. And we're going to give you some strategies that you can use to enhance these different senses. So the objectives of this course is to learn the foundations of the sensory brain functions to help with your auditory or your hearing and your visual clarity to improve those senses. We're going to talk about body awareness and spatial navigation or proprioception. And we're going to develop some strategies to help with sensory overload when your sensory system is working overtime. And then we'll give you some suggestions on how to create a personalized plan for yourself to create some lasting change. So let's jump in. So let's talk about the three parts of the brain that where the sensory information is basically processed, interpreted, and then gives you information about what you're perceiving. So the first one is the temporal lobe. So we have the temples here. The temporal lobe is just underneath the temporal bone, and it deals primarily with hearing, has some language functions, some memory functions, and also with the perception of time. In the very back of the head, the base of the skull, is the occipital lobe, and this deals with visual processing and some spatial orientation. And then we have the parietal lobe just behind the temporal lobe, and this deals with spatial awareness, touch, body awareness. So we're going to go into depth into each of these different regions of the brain and then talk about how we can enhance them. So as you know from the previous courses, the brain has an amazing capacity to heal itself and to adapt, and this is called neuroplasticity. And so enhancing neuroplasticity is basically the name of the game. That's what we're trying to achieve here. And anytime there's chronic stress or neuroinflammation, that reduces our brain's capacity to be more plastic. And so we want to ensure that we're targeting this inflammation and the stress and reducing that with whatever tools we have at our disposal so that our brain can function optimally. So let's talk a little about hearing and the brain. Hearing in the brain, you can have a central auditory processing disorder. You can have tinnitus, that's a ringing in the ear. Sometimes you can have auditory memory issues. So if you hear something, you have trouble understanding it or remembering it. And we'll also talk about how your brain translates sound into meaning. This is the Wernicke's area of the brain, and it deals with comprehension. And so the goal here is to enhance this part of the brain's function. So one of the easiest and best ways to do this is using music therapy. So you have two hemispheres in the brain. You have the right hemisphere and the left hemisphere. And these two hemispheres of the brain kind of have different functions. They're not the same. The right side deals with kind of more creative thinking, the left side with more logical thinking. We could do an entire class just on hemisphericity and the differences between the left and the right hemispheres. But in terms of hearing, you can do music that's going to target more the right brain, where there's more of a rhythm and a melody. or more the left brain, where it's more the lyrics and the speech. So different types of music are going to activate different parts of the brain. So that those using that music can be helpful. The right brain correlates with the right ear and the left brain with the left ear. So if you're having some asymmetry there, you can use music therapy to help to activate that specific part of the brain. Also, these vitamins and minerals we've pretty much recommended in every class so far. So you can tell that this is just kind of the general recommendations for brain health. Magnesium, glycinate or citrate, zinc can be helpful. The B vitamins, an activated form like methylcobalamin, and the omega-3s primarily from high quality fish oil are all great ways to enhance your brain function. So now we'll talk a little bit about the visual system in the brain. So there's two visual streams. There's the ventral part of the visual cortex, and this deals with what you're seeing. And then there's the dorsal part, and this deals with where you're seeing it or how you're seeing it. And so these different, if you're having trouble identifying what you're seeing, or if you're having trouble identifying where it is, then you're going to be targeting a different part of the brain. And so there's lots of different eye exercises that we can do. There's saccades. So saccades are, let me try and get my thumbs in the camera here. So saccades are basically where you wiggle a thumb and then you look to that side and then you look back to center and you keep going back and forth. I'm just moving my head so you can see what I'm doing, but you would normally just move your eyes. So when there's movement, that's a saccade. Then we have pursuits. So that's following your thumb with your eyes. I'm not following my thumb. I'm looking at the camera here, but you would be following your thumb here. That's going to activate different parts of the nervous system, different parts of the eyes. There's convergence, where you hold the thumb and you bring it towards your nose. You go kind of cross-eyed there. That's convergence. These are all different eye movements that activate different parts of the brain. There's gaze fixation, where you hold the thumb and then you turn the head. So you've got lots of different options here for training different parts of the brain. There's also, depth perception and training that. So lots of different eye movements that you can do in order to enhance your visual system. So here are some examples of different eye movements that people do, the pencil push-ups or the Brock string. You can also do some color discrimination training. I've even seen people wear different colored lenses. So like the red lenses are going to activate the left side of the brain, and the blue lenses are going to activate the right side of the brain. So lots of different options for training the visual system. So now let's talk about proprioception. Proprioception is part of the sensory system, and it's basically kind of telling you where your body is in space. You can test how good your proprioception is with what's called 2-point discrimination. So it's pretty easy on the hands because the hands are super sensory rich. You basically have maybe like a paper clip or something with two little points on it. You put those really close together, you touch an area of the body, and you see if the person feels both of them or only feels one of them. And you do that on different parts of the body to see how good that sensory discrimination is. This is a really common test for diabetic peripheral neuropathy in the feet. They'll do that, and this will tell them the severity of the peripheral neuropathy. So the 2-point discrimination. And then pressure tolerance, pressing on a certain area and the amount of pressure and seeing how well a person tolerates that. We've all already talked about this kind of the two hemispheres, the left and the right hemisphere, and how they control different parts of the brain. And so really the goal with rehabbing the proprioception is to get those left and right hemispheres working equally. The more equal they are in their function, the better we perform. So you can get a 2-point discrimination kit and do 2-point discrimination to test yourself. There's lots of different body awareness exercises. Yoga, Tai Chi usually fit into this as well. I've seen people use juggling and other things for body awareness exercises. And then there's also, cognitive training that you can do, like mathematical reasoning and different drills. And all of these are going to improve your motor skills and coordination, which is going to indirectly affect your sensory system. So there's also, mental mapping and spatial attention, 3D visualization. These are all different techniques to support the overall brain function. You can also support your spatial skills with directional awareness games or navigation challenges. All of these are practical skills for helping you to map out the world more effectively. And then there's also, the sensory function of our emotions as well and feelings. And so there's different types of memory. There's episodic or semantic or auditory or spatial memory. And so all of these memories aspects can be enhanced with different training. So memory palaces or mnemonics or, using facial and voice recognition to see what somebody is experiencing, the feelings they're having with what they're saying. All of these can help as well. And then we have social brain training. So this is, how you train your brain for different social situations. So the social cognition practice, if you're having trouble recognizing what somebody else is feeling, you can use the face emotion flashcards or role play. You can do different memory tasks based on conversation and then story mapping. So lots of different tactics for social brain training. So ultimately, the goal here is to reduce the sensory overload, reduce the hypersensitivity. And initially, this requires you to basically extract yourself, what we call sensory deprivation. So, basically lying down in a quiet, dark room is a good place to start. And then you start to modify that environment with different colored lights, with different sounds, with different textures, and you gently acclimate yourself to all of this sensory information so that eventually you can handle the sensory information. And there's also some self-regulation strategies. Most people kind of intuitively incorporate these self-regulation strategies, but there's specific ones that you can look into to see if you can regulate yourself more effectively. It's also helpful to regulate the stress hormones. So you do have a circadian rhythm of when these stress hormones are secreted. In general, your cortisol is supposed to be high in the morning and low at night, and your melatonin is high at night. And this provides for an adequate sleep-wake cycle where you're awake and energized in the morning and day, and you're asleep at night. And so you can also supplement to support these different hormones with phosphatidylserine or magnesium or B complex. And then also if you're, feeling overwhelmed by different sensory information, you may want to do a sensory trigger log so that you can see what different sensations trigger you and what times of day. This can be really helpful information. So as always, developing a personalized plan for you based on what you're experiencing using this information and other resources is really vital. So I would recommend dividing this up into a 3-phase program where you initially build the foundations, just supporting your overall brain health. Then you start to practice some of those skills. And then eventually you take those skills out into the real world and start to apply them and integrate them into your daily life. And so, we have some resources here that you can use to develop this plan and improve your sensory tolerance. So thank you so much. This was kind of a survey course, but I hope that you got some important and relevant information for your unique circumstances. If there's anything additional that that would be helpful for you, please leave a comment in the course or reach out to me directly, and we can help you find those different things to get you back on track. All right, thanks for watching.